Go.
Wash hands for 30 seconds.
Go.
I've gathered all my equipment together and I have checked the prescription and that is correct. I'm now going to clean the surface with a cleaner wipe. And allow that to air dry.
Go.
I'm now going to clean the outside and then the inside of the tray. And then allow that to air dry.
Go.
I'm now going to wash my hands for a further 30 seconds and I'm using the clock to time myself, I'm not guessing.
Go.
I've washed my hands for 30 seconds and dried them. I'm now going to put a pair of correct fitting gloves, non-sterile gloves, from the box on. They shouldn't be too tight or too loose.
Go.
I've gathered all my equipment and now I'm going to open my packages on the clean surface. I'm making sure not to touch any of the clean ends. I'm now going to open the syringe to draw up the amount of antibiotic that I need. Making first sure that it has dissolved. I'm checking this with my second checker as I go along. And I'm going to put this syringe into the tray, first of all, because I don't want to contaminate the end. I'm going to cover the end with a white cap.
Go.
The antibiotic is in the tray, the end of the syringe is capped off, it's not touched any of the equipment and has been kept sterile throughout. I'm now going to open the packets for my flush. So 2 ml syringe, my normal saline flush which has already been checked by my colleague, and I'm opening my filter straw, connecting that to the syringe, making sure that I don't contaminate it by touching anything, and putting it straight into the sodium chloride to draw up the flush. I'm now going to put the syringe with the flush into the tray, and I'm putting a white cap on the end to keep the end sterile and secure. I've got my chlorhexidine and alcohol wipe. I'm going to open that and remove the wipe, ready to take to the patient. I've checked the baby's number with my second check nurse. I'm now going to open the incubator door and, having checked the baby's number, give the antibiotics. This is the same technique whether we're using a central line or a peripheral line to give the antibiotics. I'm taking my wipe and I am locating the port to give the antibiotics, and I am rubbing it with some friction to clean it. This should be done for a timed 30 seconds, not a guessed 30 seconds, so the clock should be used. I've cleaned the hub and now I've waited for it to air dry. It looks dry, and so now I'm going to administer the antibiotics by removing the white cap and connecting the syringe with a no-touch technique and administering slowly as we would normally do.
Go.
Using this technique, antibiotics can be given just as safely through a central line as a peripheral line.
Go.
I've administered the antibiotics. I'm going to put the tray on top of the incubator and remove the waste and collect a Clinell wipe to clean the tray before I leave the baby's bed space. Before I leave the baby's bed space, I am cleaning the tray with a Clinell wipe on the outside and on the inside. And I'm going to wait for that to dry before I replace it in its store area. This is a non-touch aseptic technique, so if any of the parts of the syringe tip touch a surface, they need to be replaced and not used.